Welcome to the third session of our Climate, Health, and Healthcare Speaker Series. This session will focus on environmental racism, justice, and the impacts on health of communities. And we have our speaker here today, Dr. Ingrid Waldron.
So if you've attended previous sessions, tonight's going to work very similarly. So Dr. Waldron's going to give her talk, and at the end, we're going to read out some questions for her. So please feel free to type your questions into the Q&A box, and we will make sure to ask them during the question period.
And as a reminder, participants who attend 4 out of the 6 sessions and write a short reflection at the end of the series are eligible to receive a certificate for their participation in the series. We'll be sending out more information about the certificate in the coming weeks, so keep an eye out for that in your emails.
And right before we get started, we wanted to take this opportunity for a land acknowledgement. So we wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. And today, this meeting place is still a home to many Indigenous peoples from across Turtle Island. We are grateful to have the opportunity to work on this land.
So we're going to get started. I'm just going to briefly introduce our speaker today. So Dr. Ingrid Waldron was born in Montreal, Quebec to Trinidadian parents. She is professor and Hope Chair in the Peace and Health in the Global Peace and Social Justice program in the Department of History, Faculty of Humanities at McMaster University. And I'm going to stop sharing my screen and you can go ahead whenever you're ready, Dr. Waldron.
Great, thank you very much for inviting me to speak, and thank you everyone for attending. So I'm going to talk about the legacy of environmental racism in Canada and talk a little bit about some of the work I've been doing since 2012 to address environmental racism in multiple ways. So the title is From Africville to Wet'suwet'en, the social and health effects of environmental racism. So Africville is a historical Black community in Nova Scotia, which I would say is the first case of environmental racism in a Black community. And then Wet'suwet'en, I'm pretty sure you've heard a lot about Wet'suwet'en First Nation in the news, because this is the Indigenous community that I would say is getting probably most attention nowadays in terms of trying to halt a pipeline project. So I'm going to get into these cases a little later. But I want to begin with a quote, and this is a quote from the International Indian Treaty Council. And it says, from a traditional perspective, the health of our peoples cannot be separated from the health of our environment, the practice of our spirituality, and the expression of our inherent right to self-determination, upon which the mental, physical, and social health of our communities is based. So what I want to do today is to discuss the ecological health and social impacts of environmental racism in both communities, the Indigenous and Black community. I want to trace the work I've been doing over the past, I guess it's 10 years now, to address environmental racism, and also kind of look at the acts of resistance, the experiences of community mobilizing in Indigenous and Black communities, and how this mobilizing, these acts of resistance have led to success in recent years, several wins, which I think is really important to talk about, because this can be a kind of gloomy topic, but I always think it's good to remember the wins. And I think oftentimes people forget about the wins. And since you are health students, I also want to talk about how healthcare learners can address the impacts of environmental racism. So I want to begin with a quote, and this is a quote from James Desmond. James Desmond is an African Nova Scotian environmental activist. He's from Lincolnville, a very low income, rural or semi-rural community in Nova Scotia, who I met for the first time in 2013 when I went down to his community and other communities to start my work. My work is community-based, so I recognized early on that it was important for me to start building relationships with community members who are impacted by environmental racism. And he was nice enough to grant us an interview that was recorded for a very short 30-minute video that we produced at that time called In Whose Backyard, which you can find on my Enrich website. And when we asked him to define environmental racism, which when I began this project, I was constantly being asked about that term, environmental racism. It seemed like a strange term and people didn't understand it. It was certainly a term that was used in the United States, but not as frequently in Canada. And I always show this quote because I think this quote is really simple. However, it's very layered. So James says that the practice has been locating industrial waste sites next to African, Nova Scotian, Native, and poor white communities that don't have a base to fight back. You ask if that's environmental racism, it's environmental racism to its core. So you can see that it's simple. However, if you delve deeper, it's kind of layered because what he's talking about here is disproportionality, that government disproportionately tends to cite these dangerous, hazardous projects in communities that are racialized and low income, but also communities that are white. But those communities that are white are typically low income communities. You're not going to, an affluent white community is not going to tolerate having a dangerous project in their community. They're going to speak out and they're probably most likely going to be heard, right? So if it happens to white communities, those communities are typically, or perhaps all the time, they're low income, and they may also live in isolated or out of the way or rural communities, as is the case of a white community in Nova Scotia. And when he says that these are communities that don't have a base to fight back, he's talking specifically about the fact that these are communities without social, political, and economic clout or power to be able to be heard, to be able to challenge government, right? You need some kind of clout or power. And these are the communities because of race, because of income and socioeconomic status, because of social class, and because of geography, where they live, they tend to be invisibilized. But I also want to give you the more academic definition of environmental racism. And this is from Dr. Robert Bullard, who is considered to be the father of environmental justice. He is an African-American. He started doing his work in the very late 1980s, and he teaches at a university in Texas. And if you look at the definition, it's very similar to what James Desmond just said. So it's about the disproportionate location and greater exposure of Indigenous and racialized communities to contamination and pollution. Once again, disproportionality, tendency to place dangerous projects in communities that are not white. Lack of political power. These communities have for resisting the citing of these hazardous industries, right? So lack of clout, lack of political clout and social clout and economic clout. Implementation of policies that sanction the harmful and in many cases life-threatening presence of poisons in these communities. In other words, environmental racism doesn't just happen. It happens as a result of policy, just like anything else in our world that when we look at issues of discrimination or disadvantage in our social structures, whether it be healthcare or the education system, etc., it starts from policy. There are people who get to make policies, and those policies are often policies of absence because perhaps they fail to address particular issues, but there are also policies that can harm. It's also about the disproportionate negative impacts of environmental policies that often result in differential rates of cleanup. In other words, you have to ask sometimes, why is it that it took a particular Indigenous community 70 years to be heard, as is the case of Pictou Landing First Nation, which I'll discuss later, right? Why does it take some communities to get cleanup more quickly than other communities? And it has everything to do with what I said earlier. Those who are racialized, low income, lacking in a voice, the individuals who or communities that tend to be invisibilized, the communities that are forgotten, are those communities that often experience firsthand differential rates of cleanup, meaning it takes them a long time to see cleanup happen in their communities. And finally, environmental racism is about excluding the very communities that are impacted by environmental racism. So those communities are BIPOC communities. If we go broader than Canada, in the United States, they're BIPOC communities. In Canada, they're primarily Indigenous communities. However, there are also Black communities in Nova Scotia. And these are the communities that are impacted. So we have to ask ourselves, why is it that they don't have a seat at the table? Why is it that when decisions are being made at NGOs or regulatory bodies or commissions or other decision-making bodies, that the very communities that are impacted are not sitting at the table? Because if they are given an opportunity to share their perspectives and to help make decisions, the outcomes will be very different. obviously. So when that exclusion happens over time, environmental racism will continue to manifest over time because the very voices that we need to hear are not there. So I want to provide a few cases of environmental racism in Canada, starting with Nova Scotia, since that's where I began my research. And this community that you see on screen here is called Saba-Ganagati First Nation. Saba-Ganagati First Nation in Nova Scotia. And since 2014 up until 2021, this is a community that has been trying to halt the implementation of a brine discharge pipeline in their community. I just mentioned very briefly Pictou Landing First Nation. This is Boat Harbor. Boat Harbor in Pictou Landing First Nation, Nova Scotia, was an extremely contaminated, toxic site. A pulp mill started dumping effluent into Boat Harbor in 1967. Before 1967, this was a pristine area. This is where the community fished. And then everything changed when that mill started dumping effluent. So I would say that this is one of the worst case scenarios of environmental racism. Community members who have survived to tell the tale will tell you that there have been significant health effects, primarily cancer, and of course, respiratory illnesses and other illnesses that may be less serious. But for all the communities, most of the communities that I'm going to talk about today, they all talk about high rates of cancer, high rates of rare cancers, respiratory illness, gastrointestinal issues, reproductive illness, reproductive anomalies, et cetera, et cetera. You probably heard of Amjinwang First Nation. This is in Sarnia, Ontario, and is often referred to as Chemical Valley. And that name tells you kind of all you need to know, Chemical Valley. There are actually over 60 petrochemical facilities surrounding this community, which is quite stunning. And this is a community that would report high rates of cancer, birth anomalies, reproductive cancers, other types of reproductive illnesses. And I think I mentioned, I'm not sure if I mentioned respiratory illness. And of course, there are gastrointestinal illnesses and other perhaps less serious illnesses. You probably also heard about Grassy Narrows First Nation. So back in the 1960s and the 1970s, mercury was dumped into the Wabigoon English River. And while cleanup happened about 5 or 6 years ago, so millions of dollars were given by the government to clean up Grassy Narrows, you probably read quite a few articles online that indicate that this community is still dealing with the health impacts, of course, of mercury contamination. About 3 or 4 weeks ago, there was a CBC article specifically identifying the health impacts. I mean, numbness was one, which is less serious, but there were, I just can't recall all of it right now, but there were more serious illnesses. I guess I'll talk about maybe the win a bit later on, if it's a win. Once again, you know, you can have cleanup of these communities. Well, what people sometimes fail to acknowledge that even if cleanup happens, the community still has to deal with the serious health effects. So that doesn't go away. I just mentioned very briefly earlier, Wet'suwet'en First Nation in northern BC. So over the past, I would say 5 years, 6 years in Canada, there have been mass demonstrations, sit-ins and blockades that have gripped many parts of Canada over this movement to support the leaders of Wet'suwet'en First Nation. And this is in northern BC. They're opposed to a multi-billion-dollar pipeline project near their community. Now we get to the Black communities. You know, we don't often think about Black communities being impacted by environmental racism, but I think I was in a place where that certainly wasn't the case. I was in Nova Scotia, and I'm not sure why it seems that there are a lot of cases of environmental racism in Nova Scotia. I'm not sure what that's about, but I'm not going to talk about all cases, but I know about 4 cases of, you know, 4 different communities that have been impacted by water contamination or air pollution. This is Africville. I'm not sure if you heard of Africville. This is a historical Black community in Nova Scotia. So all the Black communities in Nova Scotia are historical Black communities. There are about 50 different historical Black communities. The Black community in Nova Scotia, African Nova Scotians, have been in Nova Scotia for over 400 years. So this is a community that's quite dissimilar from other Black communities. Most Black communities in Canada that are immigrants or second generation or first generation immigrants, they've been in Canada for 400 years. And they tend to live in historic Black communities that are very isolated, that are rural or semi-rural. And I think that has a lot to do with the fact that they have been subjected to environmental racism, because as I said earlier, it's much easier to put a hazardous project in a community that's in many ways invisibilized or out of the way, or that's forgotten. Nobody's thinking about this community, and they're less likely to fight back because they don't have the resources to fight back. So this perhaps is one of the reasons why the Black communities in Nova Scotia have been subjected, I would say, disproportionately to environmental racism than other Black communities in Canada. This community, Africville, had to contend with two things at the same time: gentrification, or what we often call urban renewal, and environmental racism. So the gentrification was the fact that the city of Halifax was trying to expropriate this community. They were trying to push them out of their own community because they wanted to make way for industrial development. At the same time that they were expropriating and pushing this community out to other areas in Halifax. So this Africville is an urban Black community, which is rare. As I said, most of them are isolated rural communities. So this was an urban community in the center of Halifax. So they were trying to push them out of Africville to other parts of central Halifax. And one of the ways that they did with that was actually to burn down their church. So they really wanted them out. And some people were actually pushed out on dump trucks, believe it or not. At the same time that they were pushing this community out, a lot of environmental hazards were left in the wake of industrial development. And these environmental hazards included a fertilizer plant, a slaughterhouse, a tar factory, a stone and coal crushing plant, a cotton factory, a prison, 3 systems of railway tracks, and an open dump. This is Lincolnville. So you met James Desmond earlier, the photo of James Desmond. This is his community of Lincolnville. They've had to contend with a first and second generation landfill since 1974 and 2006. Like many other communities, they would say that ever since the landfill was placed there in 1974, they have seen rising cases of cancer, rare cancers, and respiratory illness. Shelburne, another Black community in Nova Scotia. The Black community is disproportionately in the south end of Shelburne, and the white community is disproportionately in the north end of Shelburne. This community has had a landfill. So all these communities, the Black communities are descendants of Black loyalists from the United States after the War of 1812. They are descendants of Jamaican Maroons, as well as people from Sierra Leone. So this is a community, Shelburne, that's been there since the 1700s. In 1946, the town council placed a landfill, a first generation landfill in the community. This is a landfill. And everything, the community would say that everything went into that landfill. Stuff from the military base, stuff from the hospitals, syringes, etc. So it was a highly toxic site. So it's important for us to talk about environmental health inequities. So I've been touching on it, this particular issue, when I've been, showing cases of environmental racism across Canada. I mentioned that many of the communities share similar concerns around cancer, rare cancers, respiratory illness, including asthma, reproductive anomalies, reproductive illness, reproductive cancers, less serious issues like gastrointestinal issues, as well as we can't forget the mental health impacts of knowing that you live near a toxic site as well. So there are studies increasingly talking about the psychosocial stress resulting from living near to a landfill and the mental health impacts of that. So the term that we use when we talk about the communities that are most likely to have high rates of illness due to toxic contamination is environmental health inequities. And the literature in Canada, so these people here that you see in the parentheses are Canadian scholars who have looked at the issue of health over the years and have documented that there's a relationship between racialized communities that are near to toxic sites and illnesses, health impacts. So that's what we call environmental health inequities. And these health risks include gastrointestinal disease, all the things that I mentioned earlier. These are the more serious illnesses. But there's a gendered aspect to environmental racism, right? When we talk about anything, and particularly as healthcare students, as health students and health scholars, we need to always have an intersectional analysis, right? We need to look at the intersections of gender, race, culture, class, religion, gender identity, sexual orientation. We know that as healthcare professionals, that those identities intersect in very specific ways and lead to specific outcomes for people who are diverse, who have diverse identities. And when we talk about environmental racism, it's important to look at the gender dimensions of environmental racism, which I touched on earlier. In other words, when we think of Indigenous women, they're specifically impacted by environmental racism in terms of how it impacts their bodies specifically. And so then we need to talk specifically about reproductive health. When we're talking about environmental racism and the health impacts. And when we look at Indigenous women specifically, you are more likely to be living near to toxic sites, pipelines, et cetera, across Canada. There has been an impact on their reproductive health. So I want to talk a little bit about that and give you some examples. So one of the most insidious ways in which environmental racism impacts Indigenous women's bodies is through the detrimental health effects of toxic contaminants on their reproductive health, including high levels of toxins in breast milk, placental cord blood, as well as infertility, miscarriages, premature births, premature menopause, reproductive system cancers, and an inability to produce healthy children due to compromised endocrine and immune systems while in utero. So the specific gendered pathways through which contaminants get into the body and impact the body is very important to look at. We also have to talk about environmental justice, because I think over the years, and particularly in the scholarship, the Canadian scholarship, I feel that people use environmental racism and environmental justice interchangeably, and they're very distinct issues. I think because we're in Canada, as many of you know, we tend to have a discomfort about talking about racism. Let's just be blunt, right? So we're always hesitant to talk about the fact that there's racism in Canada. So I really think this translates into the scholarship that I've seen, where I've looked for articles by Canadian scholars over the years about environmental racism, and very, very few of them use the term environmental racism. I do, because I had to do this big annotated bibliography for the Federal Department of Environment 2 years ago. And of course, I included my work, but I noticed that I was really one of few people talking about environmental racism in the scholarship. Everybody was talking about environmental justice, but they're different issues. One is about justice, that's what we want to achieve, and one is about racism. So I always say that, when you go to your doctor, you want a diagnosis. You're not going to take the medication. You're not going to take the prescription until you sit down with your doctor and he says to you, this is what is wrong, Ingrid. This is your condition. This is your diagnosis. And then there's a plan, right, of action in terms of how do we address your illness, Ingrid? How do we address your condition? Maybe it's medication, maybe it's this. This is the same way that I see environmental racism and environmental justice. Environmental racism is actually the condition. It's the problem of disproportionality related to the siting of industries. Environmental justice, on the other hand, are the tools and strategies that we want to use to address the problem of environmental racism. So that's pretty clear, right? So I think it's problematic to use these two terms interchangeably, because when you use environmental justice, then what you're doing is you're obscuring the condition and the problem. It means that you don't even want to talk about environmental racism. You're trying to get to the justice part quickly, but in order to get a sense of the tools and strategies we need to use to address environmental racism, we have to have a full discussion on what environmental racism is and how it manifests. Just like your doctor, he wants to know how the illness manifests in your body, what caused it, what are some of the factors that have contributed to your illness, and then he's going to prescribe medication or treatment, etc. So it's the same way. We have to have a full discussion of environmental racism. So when we look at environmental justice, which is what certainly we want to achieve at the outcome, when we do all the things that we need to do after looking at what environmental racism is, It includes environmental justice, includes the tools, the strategies, and the policies that would focus on eliminating unfair, unjust, and inequitable conditions and decisions that lead to polluting industries being placed in certain communities more than other communities. It's also important for us to look at an environmental justice framework, and that is based on three main principles. The first one is procedural justice or procedural equity. And this is about making explicit the extent to which rules, regulations, evaluation criteria, and enforcement are applied fairly, uniformly, and in a non-discriminatory way in all communities, right? Geographical justice describes the spatial patterning of industry, the geographic location of industry, and the extent to which industries are disproportionately clustered around certain communities. So with geographic justice, you want to make sure then that the spatial clustering of industries and pipelines and petrochemical facilities are not spatially clustered overwhelmingly in certain communities, because as I said earlier, those communities tend to be Indigenous, Black, or BIPOC, right? So this is about spatial patterning, geography, placement of sites. Social justice is about looking at, well, who's being impacted? You know, we have to look at the demographic factors when we talk about social justice. Are they people who are racialized, Black and Indigenous? Are they people who are low income? People who are of low socioeconomic status, lower social class? Are they living in certain areas like rural areas? Are they living on reserves? Are they living in out of the way places? So social justice is about making sure, once again, that these communities that sit at the lower rung of our socioeconomic political ladder are not being dumped on. So when we think of environmental justice, this is a really great framework for you to use. And I think it's really important for us to stop using it interchangeably with environmental racism. And often you see an event that people are planning. Oh, we're going to do an event on environmental justice. And for me, it's like, it should be an event on environmental racism and justice so we can have a full discussion about how you get to the justice. So what have I been doing over the past 10 years through my environmental noxiousness, racial inequities, and community health project? I recognized early on that this project needed to be community-based, right? I had to get to know the communities. I had to develop relationships with the communities. But I also wanted to know the health impacts. I'm a health researcher primarily. I'm also a sociologist. So as a sociologist, I have the expertise in racism and gender inequalities and all the social identities. That is my strength, but I'm also a health researcher. So how do I intersect those issues? How do I look at the social, political, ecological, geographic impacts of environmental racism and climate change as well? I'm increasingly getting into climate change. And how do I do it in a community-based and community-engaged way? How do I do it in a multi-method way? How can I make it collaborative and partnered? How do I ensure that it's interdisciplinary, multidisciplinary, multi-sectoral, and multimedia? And that's actually what this project has become. Now that I look back on it, over the past 10 years, at the beginning, I didn't really know what I was doing. I have to be honest with you. I was just putting one foot in front of the other. And then a few years ago, I looked back and I said to myself, oh, there's a, what is it called? A rhyme or reason to this. It all seemed to make sense when I looked back, but I didn't know it at the time. So it has become all of the things that I just mentioned, interestingly enough, but I would say that it happened organically, that I wasn't necessarily planning every step out. It just flowed. And the reason it did, I think, is because I'm somebody who's open to meeting people. I'm open to meeting people who say, I'd like to meet with you in your office, Ingrid. You know, I have a few ideas about your Enrich project. And instead of closing them down and saying no, through the years, I've been extremely welcoming. And I've always been willing to listen to people, because when I did that, I've noticed that they set me on another path, a fantastic path that took me down another road. So I guess my message is staying open for me has been extremely helpful with this project. If I hadn't been open, when people reached out to me, then I wouldn't really be doing, I wouldn't have done all the things I've done through this project. So one of the first things I needed to do was raise awareness. As I mentioned earlier, people would say to me, environmental racism, never heard of it. What's that? That's a strange term. How can the environment be racist? I got a lot of that 10 years ago in Nova Scotia when I began, from journalists and members of the public who would email me not understanding the term. So I realized I had a lot of work to do to raise awareness about environmental racism. I've done a lot of that. I continue to do a lot of it. And that would include public engagement events, going to academic conferences, doing tons of talks like I'm doing tonight, doing workshops, et cetera, et cetera. This, I believe, has really, at least in Nova Scotia, has created great awareness. And it's happening in Canada, just in terms of the people who are reaching out to me. I know there's a greater awareness, but certainly because I've done most of the work in Nova Scotia, people are very familiar with the term environmental racism there. So that's really been key for my project, because when you create awareness, you create empathy. When you create empathy, you are able to better mobilize people and get them to act. So there's a nice kind of thread, I think, with awareness raising. I've also wanted to be, as I said, very multimedia, because I like creativity. I like, as a professor, to share and mobilize knowledge from my findings in very creative ways, because not everybody wants to read a book, and not everybody wants to read a 50-page report. So how do I, like an advertiser, how do I target to different people in different ways? And one way is this map, which is kind of both a multimedia tool, but it's also an educational tool. It's also a policy tool. My research assistant back in 2016 was a health geographer, which is the perfect discipline to do this work. And I said to him, well, people are doubting the reality of environmental racism. What should I do? And he said, well, why don't we develop a map? And I could do a map for you using GIS analysis that would show the proximity of various waste sites to Black and Indigenous communities in Nova Scotia. And this is just kind of a photo, but if you go onto my website, you will see that the map, and you will see one layer for Indigenous communities and one layer for the Black community in Nova Scotia. And basically what he did was he showed, the placement of landfills, pulp and paper mills, and incinerators that are near to communities. He has the names of all the communities, and it's really a great tool because it's visual evidence. And when this came out back in 2016, it was extremely effective. I mean, it was taken up by Canadian Geographic, CBC featured it, and a lot of professors at Dalhousie reached out to me to say that they were using it in their classroom. So I think for a lot of people who were doubting the reality of environmental racism, many of them contacted me and they said, oh, okay, yeah, I can see it now, right? So it's been really, really an effective tool. But as I said, an effective tool for a policymaker as well. If I'm going to visit a policymaker, in addition to data, in addition to statistics, in addition to stories, I have this map that I can take with me. In terms of multimedia, you probably heard about the Netflix documentary that I co-produced with Canadian actor, Nova Scotia-born Elliot Page. We connected through Twitter in late 2018. It's a very long story, but I was excited and shocked when it happened, still shocked. The plan was to produce some 10-minute clips that we would slap onto Twitter for the purposes of raising awareness. And then it got bigger and bigger. We spoke in late 2018, then again in early 2019, and we came to a decision after I saw a cut of the film that it should be feature length, that it should be a 70-minute film and not a 10-minute video, short video. And my argument when I went back to view the film was that I thought it was really touching, that it was important, and that slapping it onto Twitter wasn't going to do the topic justice. And if we really wanted to create awareness globally, we needed to do something more special. So I was the one who said, let's take it to TIFF. Let's take it to the Toronto International Film Festival. Let's take it to the Berlin International Film Festival. Let's do a 70-minute, let's do a long documentary form, not a short film. And everybody surprisingly agreed. And then we decided to put it to TIFF, and Elliot and Ian Daniel, the co-director, spent all day, nights, I'm sure, trying to get this ready for the Toronto International Film Festival. And in August, we heard that we were accepted to the Toronto International Film Festival, and the film premiered on September 9th, 2019. And there we are at the Elgin Theatre in Toronto. And Elliot was kind enough to, pay for accommodations and flights, et cetera, for, I think, almost all the people who were featured in the film. And then we heard that we were going to Netflix. I knew that, at some point I knew that that was happening, but I think it was confirmed in October. And this has been a true gift, it's like Netflix, who would have thunk? Like, this is not something that I expected. I never expected that my book, I should say that the film is based on my book, would turn into a documentary and then go to TIFF and then go to Netflix. Like, this is like a dream. So this has been a gift because I've heard from people around the world after it started streaming, saying to me that the film has been so inspiring and the women have inspired them. And then they say to me, what can I do? Which, once again, you raise awareness, you create empathy, and then people want to help, which is why awareness raising is so important. And I continue to kind of talk to media as well. I've talked to media and I've get granted interviews over the years, and I continue to do that because I realize that raising awareness needs to continue to happen, because there will always be somebody who doesn't understand this term, environmental racism. I also, of course, I have to do research. I'm a professor, so this is part of my job. And I've done a lot of research, community-based research, but the most recent research I'm involved in right now, I'm leading this research with a cancer biologist at McMaster. She looks specifically at race and cancer. And she looks specifically, I think, at gender. So Black women and cancer in the Caribbean and Africa, I believe, in the United States, maybe. We have a multidisciplinary team. It's very exciting. We've got a toxicologist. We've got the cancer biologist. We've got a planner architect who is going to look at the actual dump. We've got myself, and I'm a sociologist. We've got a nurse on board. We've got a member of the community, a community leader, because we want it to be community engaged. We've got somebody who's an expert on gender and environmental racism. It's kind of the dream team in terms of having a group of people who have different expertise, who can fill gaps. And what we're trying to do with this research is to look at several things in terms of what's contributing to high rates of cancer in Shelburne, which I talked about earlier. They have high rates of cancer and they have high rates of multiple myeloma. So we're looking at what's causing the high rates of cancer in Shelburne. Is it lifestyle, diet, nutrition, exercise, smoking? Is it the social determinants of health, like race, gender, poverty? Is it the dump? And that's what the toxicologist, the planner would look at. Is it African ancestry or genetics? And that's what, the cancer biologist is going to look at. Is it genetic ancestry? Yeah, which is a bit controversial because, I think you probably know as students that genetics plays a very small role in illness. It's the external social determinants of health that play a bigger factor, although the medical community hasn't caught up, and faculties of medicine are still focused on biology and genetics. We know now that it's about the structural determinants of health, but it's important for her to explore that. What about genetics? So we don't want to just assume it's the dump. What we want to do is look at all of these issues to determine what's causing it. And it might be one, it might be more than one, it might be all of them. But that's what's going to be really fascinating about conducting this research. We haven't started as yet. We are still in the ethics process, but we hope to start soon in the summer. And of course, I have to publish as well. And this is the book upon which the Netflix documentary, was based. I wrote this book, or it was published in 2018 by Fernwood Publishing. And it tracks my journey through my Enrich project of conducting this project. It talks about health. Chapter 5 is specifically on health and the structural determinants of health and the environmental determinants of health. And then I also talk about the challenges of conducting this research project, the challenges of doing community-based research, the missteps that I've made over the years, the mistakes I've made so people can learn from it. And then throughout the book, the voices of community members reverberate, throughout the book, because I want people to know about their journey. What are the challenges that they face mobilizing in grassroots ways over the last 70 years? What have they done? What have they achieved? What were the drawbacks? What were their challenges? So it's very much a community voice implanted in this book. I also want to give back to the community. I don't want to be, of course, a researcher or professor who just takes, and doesn't give anything back. And that's why community capacity building is really important to me. And one way in which I've done it in multiple ways, but I think the most important to me has been conducting water testing projects. And here's where a team has been important, because I'm not an environmental scientist. I don't know anything about conducting water testing, but I was able to, once again, say yes to somebody who said, I want to meet with you in your office, Dr. Waldron. And I said, yes. And he sat down and he said, I'm a hydrogeologist and I attended your event yesterday. It was great, but have you ever thought of doing something even more tangible for the communities? And I said, well, what would that be? He said, water testing, letting them know what's actually in their water so they know how to manage their water if they're concerned about contaminants. And I said, well, how am I going to do this? I don't have that expertise. He said, well, I'm a hydrogeologist. I'd be happy to pull together a team. And we did that. In 2016, we decided we would do a water testing project in Lincolnville. And what we did was we conducted the test. We produced a final report. We shared it with the community. We went back to the community. We did workshops to discuss the links between contaminants and illness. And then we thought this worked out really great. Why don't we form an NGO? And we did. So in 2017 spring, based on that water testing project in Lincolnville, which was a great blueprint, we formed the NGO Rural Water Watch, which you see on the screen. And Rural Water Watch continues to conduct water testing projects in rural Nova Scotian communities. We teach community members how to test their own water. We train environmental science students to test water, and now some of them are leading our projects. We do workshops. We do Healthy Wells Day annually to educate people about the need to keep your well healthy. An unhealthy well that is cracked or old can lead to illness. So we do kind of a awareness raising event on one day where we use social media, we use Twitter and Facebook, and we use Facebook Live. And we also on site, we gather samples of water from 3 to 4 communities. We test their water, we give it back to them, we tell them what the results are. So it's kind of a awareness raising day where we do our work on site, on the ground, in person. And we also do it through social media and through a Facebook Live event where we will invite an expert, typically an environmental scientist, a hydrogeologist, to talk about water contamination. I'm also getting more into climate change. I partnered with Climate Action Services in 2021 to do some workshops in 3 Black communities because we wanted to engage these communities more in climate change. I have found over the years that the Black communities in Nova Scotia, for me, have not been that engaged in the topic of climate change. And this is the issue of the day, climate change. And I think it's important for everybody to be involved. But perhaps it's just the messaging. It hasn't been the right messaging for some communities. So I thought to myself, how can I engage them in a way that's not all about the climate science? Because sometimes for people, that's scary. It's intimidating, all that greenhouse gas emissions talk, and I thought there's got to be another way to engage communities who are not familiar with those terms or are not climate scientists. So this was really great because we focus on looking at the social, health, personal, family, community-based issues around climate change impacts. What will happen in your community, in your personal life, in your family, if you're flooded, for example, and how is flooding and housing connected, and how is that connected to poverty? So really breaking it down for people so that they have a personal investment in the issue of climate change. I do a lot of education and training as well, and particularly mentorship. for students. And I said that this project has been interdisciplinary, and boy, has it been interdisciplinary. While I was at Dalhousie, I was contacted by students that I would say in so many different departments that I didn't really realize until recently how interdisciplinary the topic of environmental racism is. So I've had students from sociology, geography, planning, medicine, nursing, political science, environmental studies, on and on, who have had different types of interest, the law school, who have had different types of interest in this topic of environmental racism. I've also tried to help communities look for legal remedies. So Ecojustice is a Canadian law charity. You probably know about Ecojustice. They have offices in Vancouver, Calgary, Toronto, and more recently in Halifax. And their job is to meet with communities and try to find legal remedies. So I've introduced Ecojustice to the communities that I have been working with. I'm also interested in legislation. I think policy legislation is important. If we're really going to tackle the issue of environmental racism and we're going to hold government accountable, then we need legislation. Everything else is fine. We need to do everything else, but this to me is really key. And since 2015 in Nova Scotia, I've been trying to get an environmental racism bill passed. That never happened in Nova Scotia. So I've turned my attention to a federal bill. And Bill C-230, which was introduced by Lenore Zan in 2020, went very far. It was approved at amendments. It was approved at second reading. But when the snap election was called last year, all bills, all private members' bills die on the order paper. So that is what happened to this bill. However, luckily, Elizabeth May, Green Party MP, resuscitated this bill early this year, and it's now called Bill C-226. And she introduced it in Parliament on February 2nd. It's really the exact same bill. So we don't think we should be going through all the steps we had to go through in 2020 and 2021. So I am currently starting to launch a campaign to support Bill C-226, which was formerly Bill C-230, to ask the government to fast track this bill so that it doesn't have to go through all the stages. So I'm going to be sending out a press release probably April 20th, because apparently the bill is going to debate or second reading on April 25th. I've got actually the medical students, the Canadian medical, what is it called? HART. I don't know if you've heard of them. HART CMFS is a kind of Canadian Medical Student Association. They've joined my coalition, which I'll talk about later. And they are doing a Twitter campaign, a Facebook campaign, and they're also meeting with MPs. So we've got a whole strategy behind us in terms of how we support this bill. National partnerships is something that's key. And as I mentioned, in addition to my Enrich project, I co-founded the Canadian Coalition for Environmental and Climate Justice in December of 2020 with my partner, Naulo Charles. And what we've done is we brought together, I would say over 50 now, different organizations in the environment and climate sector, including David Suzuki and Ecojustice, on a Climate Alliance, and on, to come together, to work together, to share resources and skills to address environmental racism across Canada. This has been really exciting. We recently got some funding, which has been exciting, so we can start launching some of our small projects around climate change, environmental racism, but also urban planning. You know, we're interested in anything that's kind of space-based, spatial issues. I want to just briefly talk about the success stories. What has happened? What has happened in the past several years? Some of the wins that have happened to these communities, many of which I talked about today. Well, I talked about Sibagi-Nagadi First Nation. I said that they were worried and concerned about a brine discharge pipeline in their community. I'm just going to show you this community again. So this is Sibagi-Nagadi First Nation. They have been concerned since 2014 about a brine discharge pipeline. They've been fighting for 7 years. And all of a sudden, in October of last year, Alton Gas, the brine discharge company, decided to cancel the project, which was kind of shocking, because this has been like a 7-year project for this community, trying to stop people from coming into their community. So this is a major win after 7 years. Pictou Landing First Nation. as I said, the mill has been operating since 1967, dumping contaminated water into Boat Harbor. In 2019, at the end of 2019, the government of Nova Scotia said, we cannot keep making broken promises to this community. We've been doing that since the 1980s. It has to stop. We have to close the mill. He said that in December of 2019, and at the end of January 2020, the mill was closed for the first time. There are rumblings, however, I've heard yesterday, I think, there are rumblings that it may be open again. So that's going to be really scandalous. I'm curious to see how the community is going to respond to that. Grassy Narrows First Nation, I talked about mercury being dumped into the Wabigoon River. So in July 2021, the Grassy Narrows First Nation reached an agreement with Ottawa for $68.9 million more in funding to build a home that will care for people experiencing the health impacts of the chemicals. So as I said, yes, cleanup did happen. That was another success story, I guess, back in 2015 when millions of dollars devoted to cleanup. But however, the health impacts remain, as I mentioned earlier. So it's nice to see that some funding is actually going to a home that's going to address the health issues. Shelburne, the dump was closed finally after being open since 1946. It was closed at the end of December 2016. In addition, this is a community that has been on contaminated well water since 1946. The white community in the north has been on municipal water, but the Black community is on well water, which tends to be much more contaminated. So when I met Elliot Page through the documentary, we were walking down the street and Elliot said to me, I think I'm going to purchase a community well for the Black community in South Shelburne. And I remember saying to Elliot, I said, no, you've done so much already. You've helped us so much. You don't have to bother to do that. And then he said, yep, I'm going to do it. And he did. And he purchased a well for the Black community that's right now in the process of being implemented near the community, which of course is a major win. I've also heard recently, I think this week, that the dump that was closed at the end of 2016 is now going to be decommissioned. So I have to kind of figure out what's the difference between closing a dump and decommissioning a dump. But I think when you decommission a dump, it's much more official. It's closed for good. So these are some of the wins that have happened. I just want to kind of end with, what does that mean for you? If I have time as a health student, what can you do around the issue of environmental racism? Well, you can do anything that you want. You can do everything that I discussed and more. I used to teach nursing students when I was at Dalhousie, and we used to use the term nurse advocates. And what we wanted to kind of impart on our nursing students was that you have opportunities to do anything you want. It's no longer the bedside nurse that we see on television. Nurses can do anything. So I say the same thing to you. So you can advocate first of all, I think it's advocate to have the right courses in medicine. I hate to be critical, but you don't have the right courses if you are not being offered courses that focus on the social determinants of health, environmental racism, structural determinants of health. If all your courses are based on genetics and the medical model, then you have a problem. So I would say as students, you should be advocating for courses that move away from the traditional biomedicine medical model. I'm not saying get rid of all of them, but we now know that it is the external structural determinants of health that has the most bearing on health. So I know this is a tough one because I've been connected to medical faculties at Dalhousie and other places, and I know that they tend to teach certain things, but it's really important because if you're not getting this information, how are you going to practice differently? How are you going to do what you're doing differently? So you've got to have different courses. You've got to advocate for medical faculties and professors in medicine to embed those social and environmental issues. into courses, but into programs as well, into the people that are hired, the professors that are hired, making sure that they have expertise in those issues. It's also important for you to get involved in advocacy of different types. You can write letters and op-eds to local newspapers responding to environmental health issues, environmental racism impacting these communities. You can be credible sources. Because you're in medicine, if you're a medical student, you know, people give you respect, even if you're a student. You know, I know that when I was teaching in nursing, nurses would say to me, they would go to different parts of the world and people treated them as if they were experts, not students. People are in awe of people who are in, maybe Canadian students who are in medicine or health. You're just kind of given a certain amount of privilege sometimes when you travel. So use that privilege and write letters. You know, you will be seen as a credible source of information if you get involved in community gatherings, community committees, community boards, and other forums on various issues. You know, poverty is a health issue. If you want to get involved in a committee on poverty, then it's your responsibility to show others that poverty is a health issue. It's a social determinant of health, right? So everything is a health issue. You can get political, just like I have, you know, urge your MPs and other politicians to develop environmental racism and environmental justice bills. As I said, with my coalition, I've been able to engage HART CFMS, which is a Canadian Medical Students Association, and they're doing the Twitter campaign. You know, they just reached out to me and they said, we want to get involved. So I'd be happy to have you guys involved in my coalition or in my Enrich project. Support campaigns. If you go onto the David Suzuki Foundation, if you go on to CAPE, the Canadian Association for Physicians for the Environment, they always have campaigns. Support it. Send out tweets, retweet things, sign petitions. It's all there for you, right? Typically telling you what to do. If you go to my website, it tells you what to do. If you join the coalition, we give you step-by-step instructions on what to do. So what else? Join, yeah, the final one is join my coalition if you're interested, or join the Enrich project. I'd prefer for you to join the Enrich project because I'm now in Ontario. I've returned to Ontario in September, and I'm looking to expand, to develop partnerships, new partnerships in Ontario. I had tons of partnerships in Nova Scotia, but I'm back here again, and I'm building those. So either the coalition, if you're interested, or the Enrich project, I would be very, very happy to help you. So if you want to know how can I help, there's so many ways through my organizations that you can help around the issue of environmental racism. So I think I've gone on too long. I'd like to thank you for listening, and I'm happy to take questions if there's time.
Thank you so much, Dr. Waldron, for that talk. That was very informative, and it was a great addition to, at least for our medical school curriculum. It was great to hear about this. We do have a question in the chat, and that is, do you mind reviewing the goal of Bill C-230/C-226? What changes will it implement?
Yes, it's quite a bit. I didn't want to talk about it because I probably didn't have the time, but here it is. Oh, I didn't write it down, but I can tell you what the goals are. So number one is to collect disaggregated data based on race, socioeconomic status, and toxic burdens. So you see those intersections. Why is this important? Because the government has never collected disaggregated race-based data, because in Canada, federally, we have never collected disaggregated race-based data. However, when COVID hit, in terms of municipal government, we are doing that. So in Montreal and Winnipeg and Toronto, public health has now been collecting race-based data on COVID. And I'm proud to say, as somebody who lived in Nova Scotia, that we're not just doing that in terms of municipal work, it's provincial. So Nova Scotia as a province is now collecting race-based data on COVID. And to me, that opens the door to be looking at other things. We're in a good place in Canada. If we started for the first time ever collecting race-based data, they've been doing that in the United States forever. In the United States, they can say that Black people have higher rates of cardiovascular illness, right? Which is true. or Black men, African-American men have the highest rates of prostate cancer, which is true. And we need to know that, because how do you address an issue? How do you address health disparities if you're not collecting data? But in Canada, once again, it's, for me, it's like putting your head in the sand and pretending that there are no disparities and pretending that there's no racism, but that's not getting us anywhere. So with environmental racism, I'm happy to see that this bill is prioritizing the collection of that data. And then the second point or bullet point in the bill is that they're collecting information about health. So collecting data about the health impacts, prioritizing the cleanup of waste sites in Indigenous and BIPOC communities. The bill also talks about financial compensation to the communities that are most impacted. And it also talks about meaningful consultations with the communities that are affected. And I said earlier that these are communities that are not on the decision-making tables. They don't have a seat at the table. This is really crucial. So just from my memory, those are the 4 things that the bill prioritizes, which is so essential.
Thank you for clarifying that. That's great. And I think I know that a lot of people who are watching will also have links to the CFMS and HEART. So that's great that you're working with them already. And I feel like everyone can be directed over there to join that, as well as your Enrich project. If we have time for just one more question, somebody wanted to know about the data from your water testing project, and if that's going to be going back to the government to help advocate for improved access for clean water in these areas.
I mean, it's extremely detailed. I have the report, but I don't remember all the, I don't know if they're asking me for the contaminants.
No, I don't think so.
I know there's E. coli and this cadmium.
Okay.
We did not test for arsenic, but I forgot why. I remember asking that question a lot. Why are we not collecting information on arsenic? Because arsenic is extremely dangerous and is connected to cancer, but there was a reason why. I don't know if it's because, so we did the work for free at no cost, including the lab. And I don't know if it had to do with cost at the time. But what was shown was a number of contaminants that maybe on their own don't seem that serious, but as students, as medical students, you know that over time, these seemingly harmless contaminants could lead to cancer and other more serious illnesses. So yeah, I don't remember every single contaminant. In terms of the sending it to government, yes, when the time is right. I've been looking for Stephen Guilbeault to work with me. So Nalo and I, who co-founded the coalition, we met with, not him, but we met with his staff members twice this year. And we were very blunt, and we said, because they were interested in our map, the map I showed you. I still to this day don't know why, but they heard about it. Maybe because it's a data collection. And as I said, the bill says we want to collect disaggregated race-based data. Basically, the map that I showed you, that is an enriched map, but we're actually doing a Canada-wide map right now through the coalition. That's probably why he's interested, because it's going to collect data that's useful for him. So I'm trying to develop a relationship with Stephen Guilbeault's office. And it's slow going because they've been concerned with other things, obviously, other distractions. But once that happens, or if that happens, all the reports that I've done, the water testing reports, the findings, that's something that I would certainly like to provide to him.
Thank you so much for clarifying. And we have one more question in the chat, and that is, any suggestions on how to approach the racist conversation at work as a white woman to other white colleagues, looking for an approach to open the conversation and not trigger defensiveness? Or do I need to wait until a person has done some personal reflection and work? Just look for those individuals who are ready for the conversation.
Is it a conversation on race and the environment, or a conversation on just race?
I'm thinking, we'll maybe talk about the question on race and the environment for just in relation to this session.
Oh, that's a hard one. Well, first of all, when I started the project, I would get emails from people saying, why are you making this about race? It's a class issue. It's not about race. The people who are impacted are people of lower class, and that's why it's happening to them. So my argument for that is that, as I said earlier, there are low-income white communities that might be impacted. Think back to Flint, Michigan. In 2014, the water contamination issue that was in the media in Flint, Michigan, United States. It was a mixed community. It was a low-income African-American and white community. So white community impacted, yes. And of course, low income, you're not going to find an affluent white community typically impacted by this. But that's kind of rare. Once again, in Nova Scotia, we've got a white low-income community called Harrietsfield. And they have been contending with water contamination since the 1980s. So it's a white community, low income, I think it's rural. Once again, rural, low income white community. So there are communities that are white that are impacted by environmental racism. And when you look at their social class, they tend to be lower social class. But my question to somebody who would say, you see, look, there's a white community. It's about class, because those are lower class white people. And then the people who are Black, they're lower class too. And then my question to them would be then, why is it disproportionately Black people? Why is it that I can only find one white community in Nova Scotia, and there are few white communities in the United States? Why is it overwhelmingly Black community? Doesn't that mean that we have to look at the intersections of both class and race? I'm not saying it's not class, but when we see the overwhelming dumping of industries in BIPOC communities that are lower class, then if it's just a class issue, we should see it in low income white communities overwhelmingly as well, or at equal rates, and we don't. So it is a class issue without a doubt. But race, there's a scholar who says race makes class hurt more. So when white people try to say it's about class, it's not about race, it's about the, I always say that it's about class. If a Black community that tends to be low income, they have disadvantages. But when you pile race up on top of that, race is going to make their low class status hurt more because of the racial component. So they've got two things to contend with. So for me, all you have to do is look across Canada and see that the Indigenous communities primarily are being dumped on. You've got to look at the data across the United States and see that it's the Indigenous and Black communities and Hispanic communities are being dumped on. And in many ways, you've got your answer. It's very difficult to find a lot of overwhelmingly white communities that are impacted by this. So, but we can't lose focus on intersections, class, race, gender. What does that mean in terms of impact? But race for me is salient because of what I see in the data. So I don't know if you can open with that, but I think it's much easier for a white person to talk to white people about racism, trust me. It's much easier than it is for me, because I would be seen as playing the race card, but a white person, I don't think white people are ever told you're playing the race card. There's somebody at CAPE, the Canadian Association for Physicians for the Environment, and we were meeting, and I said, I'd like you to raise awareness and talk about environmental racism. She said, Ingrid, I don't think I should. I said, why shouldn't you? Well, I'm white. I said, I think they're going to listen to you more than they're going to listen to me. I said, we need white people to talk about this, because people's ears will be kind of propped up when a white, it just comes across better. It goes down better, I think, when a white person talks about racism, because they're not being seen as playing the race card, and I would. So I encourage white people to talk about this and to not be afraid, and not to point fingers, but to provide data.
Thank you so much, Dr. Waldron. And I just want to sincerely thank you so much for coming today and discussing with us this really important topic. And I think you shed a lot of light onto it for all of us in different healthcare professions across Canada. So we really appreciate it. We've definitely learned that we have some definitive plans of actions and steps that we can take for the future to get involved with. So that's really amazing. So thank you. And thank you to everyone so much for attending and participating in today's talk. We loved seeing all your comments and questions. And please remember, we have another session coming up in 2 weeks, and we would really look forward to seeing you all there. So thank you so much again, Dr. Waldron, and have a good rest of your evening, everyone.
Thanks, everyone.
Thank you.
Bye-bye.